As in this 2 to 3 minutes, we are discussing the lessons that we have learned in last lecture class. Okay, it is anion gap is the plasma anion gap is the difference between unmeasured anion and unmeasured cations. The normal anion plasma anion gap 8 to 16 millimole per liter. The significance of anion gap is it is used for categorization of metabolic acidosis. That means by plasma anion gap we can categorize metabolic acidosis into high anion gap metabolic acidosis and normal anion gap metabolic acidosis. Okay. Anion gap remains normal in diarrhea, renal tubular acidosis, and in high anion gap, that is lactic acidosis, diabetic ketoacidosis. In this condition or renal failure, anion gap increases. Okay. And normal anion gap metabolic acidosis. This normal anion gap metabolic acidosis can be due to diarrhea and renal tubular acidosis. By further analyzing the urinary anion gap, we can categorize, we can understand the difference between, we can differentiate uh, we can differentiate diarrhea and renal tubular acidosis. In renal tubular acidosis, it moves towards positivity, and in diarrhea, it remains negative. Anion gap, urinary anion gap definition. Urinary anion gap is the difference between sum of urinary cations and urinary anions. Is it clear? It is the difference between urinary cations and urinary anions. Urinary cations include sodium, potassium, and urinary anions include chloride. Normal urinary anion gap is minus 22 minus 50 millimole per liter. In metabolic acidosis, urinary anion gap increases. Okay, and the RTA, the in RTA anion gap moves towards positivity, and in diarrhea it remains negative. So it is useful for categorization of for understanding the difference between diarrhea and renal tubular acidosis. That means for categorization of normal anion gap. Is it clear? Next we will be discussing our next topic. Today's topic is osmolar gap. It is important. Osmolar gap means then plasma there could be some osmotically active substances, and because of this active osmotically presence of this any problem, because of the presence of osmotically active substances in plasma, osmolar gap can increase. Okay. So osmolar gap is the difference between observed or measured plasma osmolarity and calculated. Here there could be problem. Observed, that means observed means measured. Observed means measured. Okay. And measured means it can be estimated through some instrument. An instrument used for measuring the osmolality is osmometer. Osmometer. So the difference between observed osmolality and calculated plasma osmolarity. Calculated plasma osmolarity, it can be estimated from concentration of sodium, potassium, glucose, etc. Glucose, urea. Okay. So calculated osmolality, osmolar gap. We understand the measured osmolality minus calculated osmolality. Measured osmolality, as it is measured by some instrument, that's why it should be accurate, and it's more than calculated osmolality. So osmolar gap is the measured osmolality minus calculated osmolality. Calculated osmolality, we can calculate osmolality if we measure if we measure the sodium extracellular sodium concentration, potassium concentration of sodium, potassium, glucose, urea in extracellular fluid. Okay. So osmolar gap, normal osmolar gap, we should know it is normal value is less than 10 milliosmol per liter. Osmolar gap is high or osmolar gap increases in ethanol poisoning, ketonemia. Ketonemia, that means more ketones in plasma. Hyperlipidemia, that means when cholesterol, triacylglycerol, these are more in plasma, and also in another condition, that is hypoproteinemia. Hypoproteinemia. Okay. Significance of osmolar gap. Osmolar gap is increased. We mentioned earlier at the start, osmolar gap increased in presence of excess of osmotically active substances in the plasma. And these osmotically active substances in the plasma can be glucose, ketones, alcohols, electrolytes. In our country, it is in Western countries, it is mostly osmolar gap increases due to alcohol poisoning, and in our country, it could be due to glucose ketones like this or electrolytes. Okay. In Western countries, the uh, police police uses this osmolar gap by osmometer and can understand. They find the gap is more, they understand that this person could be alcoholic. Okay, and they do then appropriate tests for identifying the liquor. Okay, so in alcoholic poisoning, the osmolar gap increases. It could also be increased when the plasma contains excess of glucose. Excess glucose ketones could be present in uncontrolled diabetes mellitus. Okay. Osmolar gap, we have finished. This is very small contribution. Now we will be proceeding to another important topics, that is this titratable acidity will be discussing later. There's a renal function test, assessment of renal function. Assessment of the renal function we can do by these methods. Glomerular function we can assess by estimating blood urea, blood creatinine. Blood means plasma, plasma urea, plasma creatinine. Clearance tests, inulin clearance test, creatinine clearance test, and protein in urea, that microalbuminuria. Protein in urea, microalbuminuria, proteinuria and albuminuria. Okay. Next, tubular function test, the urine concentration test, urine dilution test, phenolphthalein test, acidification of urine, renal plasma flow by filtration fraction, para-aminohippuric acid tests, and Another important parameter for understanding the renal function are estimation of plasma electrolytes, and those electrolytes include potassium level and at the same time estimation of blood pH and estimation of plasma bicarbonate level. These tests ultimately help to understand the urinary abnormalities in renal failure and the abnormalities of renal functions. Okay. Okay. Next.
We're back.
Clearance, plasma clearance. This is most important topics for exam. That's why its preference is comes first. The plasma clearance. What do we mean by plasma clearance or definition of plasma clearance? That is important to understand. You note very carefully. Concept of plasma clearance. Plasma clearance means volume of plasma completely cleared of a substance that passes through the urine per minute. Volume of plasma completely cleared of a substance that passes. That passes means that substance, not plasma. That passes in urine per minute. Is it clear? It can be shortened if the definition is clumsy or if it is bulky, then it can be shortened. Volume of plasma completely cleared of a substance per minute. This is short definition. It can also be defined as volume of plasma which contains the amount of substance excreted in urine flow in 1 minute. That means 1 minute's urine flow. Volume of plasma which contains the amount of substance excreted in 1 minute's urine flow. It is one thing to understand. Anybody is trying to enter. Okay, this is late. So we'll be making entry again. By this time, we close this. Okay. Plasma clearance, plasma inulin. Suppose say for plasma inulin clearance. Plasma inulin clearance we know 125 ml per minute. This means amount of inulin passed in urine in 1 minute. In 1 minute that is equal to the amount found in 125 ml of plasma. It does not mean, note it, it does not mean that 125 ml of plasma passed through kidney in 1 minute. How plasma can pass through? Can enter into the tubules because plasma contains proteins and plasma molecular weight is higher, so it cannot pass through. It cannot pass through glomerular membrane. Mind it. Okay. Okay. Plasma. So that's why again remember the definition. Plasma clearance means volume of plasma completely cleared of a substance that passed in. That passed means that substance that passed in 1 minute's urine flow. Okay, and this plasma clearance of a substance is equal to plasma clearance of a substance will be equal to GFR if the substance is neither reabsorbed nor secreted nor changed in the tubule. Okay, up to this I think we are clear. Okay, if somebody is trying to enter, or somebody may leave, that does not matter. Okay. Next, we frequently ask in the exam one question. What do you mean by inulin clearance 125 ml per minute? What you understand inulin clearance 125 ml per minute? Amount, this means amount of inulin present in 125 ml of plasma eliminated or excreted in 1 minute's urine flow. Is it clear? 125 ml plasma cleared of inulin per minute. It can be shortened to this. Okay, that means 125 ml of plasma cleared of inulin per minute, and that inulin is passed through the glomerular membrane. Okay, what do you mean by creatinine clearance 135 ml per minute? Amount of creatinine amount of creatinine present in 130 ml of plasma excreted in 1 minute's urine flow. Is it clear? The clearance rate of creatinine is more than that of inulin, and it indicates that creatinine, this indicates that creatinine is secreted into the renal tubule. If anything, if the clearance of a substance is more than that of inulin, that means something is secreted into the renal tubule. If the clearance rate is less than that of inulin, it indicates something that is reabsorbed, in the renal tubule. This is the theme. Okay, 135 ml plasma cleared of creatinine per minute. It means the creatinine clearance 130 ml per minute. Is it clear? That means 130 ml of plasma completely cleared of creatinine per minute. Is it clear? On that passed in urine. That passed in 1 minute's urine. Okay. Is it clear? Is it clear? Next, come to the point again. For a freely filtrable, if a substance is freely filtrable through the glomerular membrane, then its plasma load will be equal to tubular load equal to urinary load. Okay, plasma load. Plasma load means volume of substance, volume of plasma filtered this per minute. Is it clear? Volume and into plasma concentration of that substance. Clear? And urinary load means concentration, urinary concentration into volume of urine pump per minute. Is it up to this? I think it is clear. That means it in simple way to understand, if a substance is freely filterable, its concentration in its concentration in plasma and urine may vary, but a amount remains same. Is it clear? Is it clear? Urinary volume of plasma, that means this is plasma load and this one is urinary load. Plasma load, that means volume of plasma filtered per minute into plasma concentration. Okay, And urinary load means concentration of a substance in urine into volume of urine passed in 1 minute. So plasma clearance is equal to urinary concentration of a substance in urine into 1 minute urine flow. 1 minute, this V, big V, capital V is 1 minute, indicate 1 minute urine flow divided by plasma concentration. Okay, and we get, ultimately we get the plasma clearance of that substance. Is it clear? Urinary clearance. Suppose if we want to get urinary clearance, the urinary clearance concentration of substance inulin in urine into volume of urine passed per minute divided by concentration of plasma, concentration of inulin in plasma. Similarly, creatinine clearance indicates CCR. It indicates concentration of a substance, concentration of creatinine in urine into volume of urine passed per minute divided by concentration of creatinine in plasma. That will give creatinine clearance. Definition we have covered earlier. It can be discussed if necessary. Definition should not be forgotten. That is important. Okay. Urea clearance. Come to the point. Urea clearance. Urea clearance means concentration of urea in urine into volume of urine passed in 1 minute divided by concentration of plasma urea concentration. That means concentration of urea in plasma. Okay. Up to this, I think there is no problem. Next, we will be. Then this we mentioned the clearance of a substance when equal if when it's when equal to inulin, that will give measure to GFR, estimation of GFR. And GFR estimation we can do, accurate GFR estimation we can do by through inulin clearance, and creatinine clearance that can also be used for clearance tests. Okay, is it clear? For estimation of GFR. And there is some advantages and disadvantages of using this creatinine that will be dealt in differences. At the end of this slide, we'll compare the inulin clearance with creatinine clearance. Is it clear? So this creatinine clearance is easier because this creatinine is endogenously produced. And inulin clearance is a bit difficult because inulin must have to be introduced into the body. If something to be introduced into the body, it must be made pyrogen free, and making pyrogen free, it is also difficult, but result we will get accurate result with inulin clearance. Inulin clearance will give you accurate measure of GFR. Is it clear? So if creatinine clearance, we consider the creatinine clearance is almost equal to GFR, near equal to urinary creatinine concentration. If we do the estimation of urinary creatinine, that its value is 12 millimole per liter. Plasma creatinine concentration, we know the, the plasma creatinine concentration 100 micromole per liter. Volume of urine formed per minute, say 1 ml per minute. Okay, your percentage is being given, don't worry for percentage. So GFR is equal to concentration of creatinine in urine, concentration into divided into 1 minute's urine flow divided by concentration of creatinine in plasma creatinine concentration. Okay, and here we find this 12 millimole. 12 millimole means 12 into 1000, that will produce 12,000 micromole. If this 12,000 micromole is divided by 100, it will give the result like this: 120 ml per minute. Is it clear? So GFR, if we by knowing the concentration of creatinine in plasma and in urine, we can, and by estimating by observing 1 minute's urine flow, we can estimate the GFR. Is it clear? And next come to the point we wanted to discuss: tools used for GFR estimation. Inulin. Inulin is mentioned first. The inulin clearance is considered as gold standard for estimation of GFR because result is accurate. Result is accurate. That is, the only problem is it should be administered into the body, and that when it is administered to the body, it must be pyrogen free. Again, you must have to wait until its concentration in the plasma becomes stable. Because of these differences, difficulties, we frequently estimate creatinine clearance, that is alternative to inulin clearance, and value is near accurate. Near accurate, that means the creatinine clearance value is a bit more than inulin clearance because creatinine is secreted in the renal tubules, and which do not happen in inulin. Inulin is freely filterable, neither reabsorbed nor secreted nor changed in the renal tubules. Okay, other substances, iothamalate and radioactive EDTA. Next, come to the significance of plasma clearance. Plasma clearance of inulin is used for estimation of GFR, which is an important indicator of early renal failure. That means we can detect early renal failure by estimating GFR, and that means by estimating the plasma clearance. Okay, plasma clearance of inulin or creatinine. Another importance of clearance is para-aminohippuric acid clearance is used for determination of renal plasma flow. It can also be used, this clearance test can be used for clearance of drugs, toxins, poisons in clinical. These are the important clinical parameters in clinical side. Is it clear? For whether a drug is normally passing through the urine, or a toxin or poison passing through the urine, we can understand by estimating the clearance. We wanted to discuss, we wanted this Rohit, who is Rohit is 49 at the end hours is joining. GFR estimation by anion clearance is accurate. Is most accurate means that means it is most reliable. Okay, and GFR estimation by creatinine clearance is fair approximation to accuracy. It is though it is not accurate, completely accurate, but it is near accuracy. Inulin clearance, inulin requires to be injected through IV routes. Time must be allowed until plasma level stabilized. We mentioned, and creatinine is an endogenous substance, endogenous excretory substance. Creatinine is produced in the body. In body, creatine, there is creatine phosphate, and when this creatine phosphate it is metabolized, there is from creatine. Creatinine is produced, and this creatinine it is a excretable product. Excretable product. Is it clear? Creatine phosphate, that is a energy equivalent like ATP. Okay, this creatinine so is endogenously produced. It is excreted through the urine. Inulin to be used infused must be pyrogen free. We mentioned, but creatinine as it is produced endogenously, it need not to be making pyrogen free. Okay, this is important to understand. Okay, osmotic clearance, there is another we can discuss this. Volume of plasma completely cleared of osmotically active substances per minute. Definition is almost like plasma clearance. uh, is it clear? Volume of plasma completely cleared of osmotically active substance. Here this is the only difference is osmotically active substances per minute. Okay, osmotic clearance, this is same. If this same, that estimation of estimation of osmolality in the urine into 1 minute urine flow divided by plasma osmolality, and that will give you the osmotic clearance. Okay, free water clearance, volume of electrolyte free water excreted or retained during glomerular filtration can be termed as free water clearance. Free water clearance is the difference. Another definition, this definition is a bit easier. Free water clearance is the difference between urine flow rate minus urine flow rate and clearance of solutes in plasma. Okay, the first definition is volume of electrolyte free water excreted or retained during glomerular filtration can be termed as free water clearance. Free water clearance, as we mentioned, the difference between 1 minute's urine flow minus osmotic osmotic clearance. Urine flow, that is, so this is from previous discussion, osmotic clearance. Okay, free water clearance is the retention of excretion or it is retention or excretion of electrolyte free water per minute during formation of glomerular filtrate. It can be defined as difference between urine flow rate and osmotic clearance. Okay, free water clearance is free water clearance negative means water is being conserved and more solute passed in less urine, and free water clearance positive means more water is being excreted, less solute is passed. That means urine is dilute. This is important to remember. Okay, when it is negative, if the free water clearance is negative, that means urine is concentrated and water, body is conserving water. If it is positive, that means water is being excreted and less solute is passed in urine. Urine is dilute. So we can conclude here